don't think it's a good idea bringing all the problems downtown.
I do support the idea of listening to those experts and trusting the science on it.
Mixed reaction on Wednesday to the relocation of the Yaletown overdose prevention site, which closed its doors to clients on Seymour Street at the end of March.
You know, there has been some conflict there with people in the community and other users of that building, and so we couldn't stay in that location.
The move comes after Vancouver Coastal Health was informed by the City of Vancouver in July 2023 that the lease for the Seymour site would not be renewed. The new site opened on Wednesday on Howe Street in a space behind a social housing complex.
It will allow us to provide both supervised injection services, which we provided at the other location, but also supervised inhalation services. You know, we've seen a real trend in the way people are using illicit drugs recently, where people are increasingly smoking their drugs. And also, you know, when we look at overdose deaths, that people are more likely to have smoked their drugs than injected them.
Dr. Mark Lecision, the Deputy Chief Medical Health Officer at Vancouver Coastal Health, says an overdose prevention site is essential in the city centre, which has the second highest overdose mortality rate in the Vancouver Coastal Health region after the downtown east side. He says the Seymour location saw around 100 visits per day. In a statement, Vancouver Mayor Ken Sims says he's disappointed that the new site is not located at St. Paul's Hospital.
Originally, you know, we started offering an overdose prevention site on the grounds of St. Paul's Hospital, but then that wasn't meeting all the needs, and so we moved it a little bit closer to Granville Street, and you know, that's when we opened the Seymour location. And you know, more and more people were starting to come to that location.
A controversial topic that's left the community divided.
I think there's enough problems already, being that there's a shelter there, and the residents that live here are already complaining about the noise and the problems with other tenants, as well as the shelter. So this is going to be sort of triple indemnity added to their already problems.
I understand that it's your neighborhood and it's your children and it's your life, and I respect your choice and your ability to speak out against things that you don't want happening around that, but we can't do that at the expense of these other people who are people.
In Vancouver, Kate Walker, City News.